Welcome to the research training for patient and public involvement members within the Cicely Saunders Institute. The fifth and final stage of research that we will be going through is disseminating the data. Once the data has been analysed, it then needs to be shared, and this is called dissemination. Dissemination involves communicating the findings of a research study to a wide range of people. This is implemented through various methods such as producing reports, publishing articles in journals or newsletters, or giving talks at conferences.
It's been so helpful for them to understand, these are professionals who are delivering palliative care services, to understand the challenges that patients have. And as a consequence of that, by helping to share that information out there with the healthcare professional, with the community support groups, it has been so valuable that people are beginning to recognize that we must ask the question, is patient receiving the best quality of care? Are they being given a choice of what kind of service they would like? And that has been the meaningful impact from the better end of life. And for that reason, I will encourage both the members of the public to get involved in research, but also for researchers to respectfully listen, to understand, and to consider what members of the public are saying, so that whatever decisions and outcome and recommendations are made in the research, members of the public can help to share that information with their neighbours, with the communities they live in, and with the policymakers they're working with.
The Cicely Saunders Institute is obviously a very forward-facing department, so we focus on conducting research that produces evidence for the purpose of making a change outside of the university environment and make a change in the real world. That process goes on from the beginning of a research project all the way through the end and beyond. So it's just a case of kind of planning those impact activities, and a PPI member can take part in any one of those. We produced a policy brief quite recently calling for better palliative and end-of-life care for people with dementia, and that was informed by a lot of research and the evidence that was produced within the department. And we had a number of PPI members involved in the research, and one of those PPI members was invited to attend the launch reception, which was held in the Houses of Parliament, and that reception was attended by different peers, MPs, and also some kind of representatives from a whole range of organisations, so from NHS England and the Department of Health and Social Care to different charities and think tanks, and also some Royal Societies as well. The PPI member came along and we invited them to actually give a speech at the event, and they did a fantastic job, and I would argue that it was actually their speech and their involvement on the day that actually was the most influential. It had the biggest impact and it was most important, and I think the reason for that was because their speech just placed all of the research in that policy brief into the real world context, and it made it very real for people. So all of those policymakers in the room could hear why it was important to have that research undertaken, but crucially why they should be listening to that research and using that to help inform their decisions. So that was just one example of how PPI have kind of supported us trying to make a change from our research, but there's plenty of other examples.
If you have any further questions about how research works or how you can get involved in research, please feel free to contact csi.ppi@kcl.ac.uk.